Welcome to CC Health Boulevard, where we discuss real-life challenges. This is your go-to program about mental health, physical health, self-awareness, and healthcare tips that will help you lead a healthier and happier lifestyle. This program is brought to you by Cross and Clara, so stay tuned. Hello, Crossy.
Hello, Clara. Long time.
Yeah, long time. How are you? Happy Easter.
Easter.
Yeah, so welcome to yet another edition of CC Health Boulevard and featuring Cross and Clara. So today we are going to be talking about high blood pressure, also known as hypertension, also known as the silent killer. And Cross, now you will really tell me more about this high BP, because when it comes to physical, you are into more physical stuff, and me na mental, as everyone knows. So tell us, wait, of course, I know the viewers, hypertension or BP, we don't get a lot of people where they don't just fall, we don't hear say they die unexpectedly, where they get either heart or failure or cardiac arrest, or they don't just fall. Yes, some person don't just slump for a house, for a room before die, or yes, a person don't sleep, because for bed, he sleep, die for bed. We don't hear of cases like that a lot, especially for people where they outside country, bush fallers, where they the west, and we don't hear a lot of cases like that. So now really a silent killer, and I really want me to really shed more light into it so that people go know what to be high blood pressure, and no say this one not to if it affect anybody, not to if it affect any man, not to know that like I'm too young to have high blood pressure. There is nothing like that. It affect everybody. So Klaus, if you tell us more about this high BP, this silent killer.
Thank you, Clara, for this opportunity. First of all, I'll first start with the definition of high blood pressure. The other name is arterial hypertension. Yeah, people will say I get BP, I get BP, I get BP. Some people they get gastric, they say they get BP. You understand? People just say maybe when I had the drop, maybe I had a beat fast, it means I high blood. No. High blood pressure now when your blood like the pressure where the pump where you had the pressure of blood to come out from your heart, it be greater than 140 on 90. That's your systolic and the diastolic period. That one although not be important, but normally when you go hospital for diagnosis, now when your blood pressure will be greater than 140 over 90. Therefore, for normal adult like me and you, like if we not reach 50 years, our normal blood pressure supposed to be from 120 to 140 on 60 to 90. That's the systolic and the diastolic pressure. That's the when you take this measuring instrument like sphygmomanometer, where doctor put on the ears, you put on money hard, it may loop do. That sound we had the pump blood at the pressure that we had the pump blood. I think the loop na the systolic pressure, while the dope na the diastolic pressure. Understand?
Yeah.
So if you had the pump blood more than 140 over 90, therefore you get a little bit of problem, but you become hypertensive, you become a patient when that blood pressure will be higher for a very long amount of time. If you just go hospital, they measure you for your first visit, they do you they measure your BP, it shows say your BP high, and then you feel say you be hypertensive. No, stress. Because maybe come up from a fight, maybe they don't fire you from work. You understand? So circumstances they make your BP the high. But if you prolong for a very long amount of time, maybe for your first 3 visits, then you have a high, therefore a call of concern. You understand? High blood pressure. If you see am from small pikin right up to grandma or grandpa, if you see am to pregnant women, then so yeah. So and I would say basically not just the definition that for high blood pressure.
Okay, so I think ma give a recap. Wait till we cross on talk be say ma in short terms, right? Cross the blood the blood pressure where it dey flow through your blood vessels, it be greater, right?
Yeah,
If you feel
yeah.
talk it be greater than how it's supposed to be,
It's supposed
right?
to.
Yeah, I don't
Yeah.
want to see if we fit talk am the way
Yeah, man.
Papa go village fit understand. So when
Sure.
it be greater, when it become greater, and there are some aspects where it provoke those your blood pressure and also lifestyle changes to the cause am, the affects that pressure. And as you don't talk, say it happen like um situations if it cause am. Okay, for instance, if I be stressed right now, if I be so stressed right now, or if I be anxious right now, I test my blood pressure. It go show say it don't increase.
For sure.
Yes, if I be anxious right now, I test them. It go show say it don't increase. It don't pass that normal 121 2080 where it's supposed to normally be. It go don't pass them. So now, if you honestly, as we talk now, true, nothing way like if you prolong, if you go test them right now, if they so you say and say no, nothing way. If you be stressed, then later when you don't calm, be calm. You test them, you go realize you don't go back down,
True. Certain.
right? So you feel really tell us more really like talk. Wait till they really cause this high BP, this high blood pressure. Because I believe say our people really go really like for no more talk on waiting.
Yeah, yeah, yeah. Firstly, like we talk say, high blood pressure, like normally for a household, so it cause high blood pressure, salt intake.
Mm-hmm.
Understand? When mommy they like me chop over taste, you know.
Mm,
You know, say anytime salt go, water they follow. If you
mm-hmm.
put salt inside a mop now, within the next 1 minute or 2 minutes, you go find water for drink am. When water follow, volume dey increase. When volume increase, pressure dey increase.
Mm,
You understand?
mm-hmm.
Yeah. So we get salt, we get obesity, people wey dey over fat.
Mm-hmm.
Okay, consider your arteries or your veins like pipe. Of course na pipe. You
Mm-hmm.
understand? Of course na
Mm,
pipe inside human body. E dey so. When you over fat, cholesterol, fat dey deposit inside that pipe. You
mm-hmm.
understand?
Mm-hmm.
When fat be deposit inside the pipe, it make the hole where water suppose flow or blood suppose flow, it be thinner. Where it be thinner, take water pipe where you use water a garden. If you press am, the pressure dey increase. The pressure dey increase, you no mean say the volume dey increase or you no mean say the amount of water dey increase, never. The pressure dey just increase. It dey flow with speed. So people wey be obese, people wey dey fat a lot, they need to be watchful.
Mm-hmm.
You understand? It really
Mm-hmm.
cause yeah, high blood pressure. People wey get heart conditions,
Mm-hmm.
people wey be diabetic,
Mm.
they need to be very careful too. And then stress.
Yeah, stress for that one. For that one, I think the number one actually. Stress the
Stress
number one
is
cause for
yeah,
high blood
yeah.
pressure.
It plays a lot.
Yeah,
People wey dey be very lazy, wey they need one
yeah.
for do exercise.
Mm-hmm.
They need one for do
They
exercise.
know the one even for comot, for pay. Now one thing that for pay my paysan the way honestly it be so anyway, I no wan say it be discouraging because yeah, always people know they the same. You understand? But I know lie you,
Sure.
my paysan them, now very few of them be act when it comes to like, keeping fit, like being
Yeah.
physical, keeping fit and stuff like that. You understand?
Right.
Now only very few of them be athletic. Now very few of them the if only for 10 person say make comot waka, make comot take a walk, na problem. You
Problem.
know they say
Very big.
that mean say waka say e start na how? Waka say you want waka go now outside. No,
But
say that one
if
honestly.
you know waka, listen a poor man. Where the waka they look
When
and
you
say you
waka,
poor
they
na
say you
poor.
poor, you don't get money for taxi, you don't
Yes,
get
you
money for
poor.
life,
Or you conto.
which is not the case. You understand?
Ah,
Which is not the case. Me myself, I be guilty of that. I be there, that be the I for Bamenda where I grow up, right? I be stay for Cow Street, Ghana Street. For come off a day go commercial avenue. If you don't get bike money for taxi, you understand? If you don't get money for hell, sometimes the be I want come off with go market, I take bike. Sometimes the beer I don't come out, walk away and walk for like just 15 minutes. I dey take bike. That is how like that means and when I something where it really be important waka. No be like see for here rich people. You see rich people they come out every morning, pop, 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 na that for streets. Na that for
yeah,
streets. Oh,
whatever
they get money.
bicycle, the dog.
Yes.
Yeah.
So that mentality say this whole waka. If you know what way waka they do for your body. I mean taking long walks, not just the waka stroll, I mean taking, being intentional with the walking. Being
Yeah.
intentional with the walking. So now one thing that we would really like to for encourage our people say this will know it not mean say me necessarily go gym. Just take a walk. It be so helpful when it comes to your health. And when you did take a walk and also your lifestyle, um, your what you eat,
Modifications.
yeah,
Yeah,
what you
okay.
eat also, you know, uh, determine on if it cause your high blood pressure to rise. So we need to take more of protein and less carbs. Of course, carbs na fat storing, carbs be fat storing, while protein be fat storing. So of course, when you take less carb, that means you limit your chances of adding weight, putting on weight, which of course so cross
Yeah, alcohol
continue.
too as a one
Alcohol and cigar
very yeah.
and smoking.
But have you seen cigar? Have you seen cigar? I know call cigarette,
Anyway,
especially nicotine. I
uh-huh.
know call cigarette. Cigarette, yes, but it depends the kind of cigarette you smoke.
Yeah, I think so.
Yeah, it depends the kind because cigarette too na drug for
Hmm.
blood pressure.
Yeah,
Cigarette too na drug. So I know call for now, man not talk to I don't know. But I'll call alcohol. Alcohol it raise blood pressure very badly.
yeah.
Yeah. So and then people they just get high blood pressure genetically. They run for family just like that.
Hmm.
Maybe some that genes and be
Yeah.
manipulated.
It be genetic too. It be
Yeah,
genetic
yeah,
too.
yeah.
Even though that I think that one I very little
No, 95% for the cause of high blood. Now one of those things that people they just get high blood just like that for no reason.
genetic.
Yes, yeah, when
That's
they
why the
reach some
percentage
age.
high.
Yes, when they reach some age, you just see say maybe from 40 something, you just get high blood. They don't get no problem, they no fat, nothing, they just get high blood.
Yeah, even if
Yes.
yeah, and I would like to for add say this so high blood be so more it be more common in males in men especially when they don't reach 40 years it be so common in men and
Yes, my
high
mommy.
and that one be quite understandable. That would be quite understandable. Stress. Now, why that would they say stress?
Too much. Okay.
One of the leading factors because men, when they don't reach 40 years old, yeah, that stress of raising a family, that stress of where I want to building a home. I think that the most highest that stress factor that for men when they don't reach 40 years old, now for raising a family and making
Yeah.
sure that saving money, and all those things. So now by that way, it be more common in men. And now from that you see and say so stress now the leading factor because yes, now
But
from there you see and say stress is a leading factor. And especially also those in the West here, people they don't travel, bush the way they don't travel to things can be very hard outside here. Some of them they be so stressed when they just die inside their room. Them you do I as a person, you don't go knock my door. If you don't die, they for your room days, no man no know.
yeah,
So now
true.
stress the cause am. And
And
also
then so other thing to so it's clear. So other thing to not say Picking they not breastfeeding, they be prone to get high blood pressure where they go older or premature picking them. Another cause too. And then plenty of mommy they hear say the pregnant woman get the man wey dey obele get pre-eclampsia. They don't really know the maybe doctors didn't really explain them for them the meaning of pre-eclampsia. Pre-eclampsia and high blood pressure for pregnant women. High blood pressure and when protein dey appear for urine. So we really need to be watchful. At least if you hear for hospital say you get pre-eclampsia, you really need to take that bold step for work on yourself, you reduce your salt intake or you do more sports or other kinds of things. But picking the way that mommy need breastfeed them, it be very dangerous for them. So breast milk really be good for picking their life. Yeah. So
And also I believe say this high BP dey so e dey in stages, because hypertension, of course, we say the normal this thing na this thing 120, right?
yeah.
120 slash 80. 120 slash 80. So of course, when you pass that 120, go for like you say 130 or 130 something slash above 80 slash maybe 90. I think that the first stage that for hypertension. And then you feel if you really talk about the stages, and then when you don't go for like 150, like 150 slash 90,
maybe 100,
90 and
100.
above. Yeah, 90 and above or 100 and above. That one at the second stage of hypertension, and that one at emergency, you need for like see a doctor immediately. That one at the emergency stage.
Okay,
That
yeah.
at the emergency stage. So also very importantly, I want make people, it really be important make people know say, make una know say a high blood pressure no get symptoms, especially when you dey for that first stage of hypertension stuff. There is no symptom.
Exactly.
There is no, now why that they call am silent killer.
Yeah.
E no get symptom. So no check say they so you go hospital, you go wait where head don ache, or when something don't do you, then you go rush, or when you feel dizzy, you go rush go hospital. No, e decline. So now when you go don reach that emergency stage, that stage where you don dey for that kind, maybe 150 and above slash 150 slash 90 and above. Now from there where you fit start whether one at the emergency point where you fit either get, we never even talk on the dangers of this thing. We'll get for
Man shock you, Man shock you. Plenty people never go hospital for go consult for different sick. Person hardly go hospital go consult for check whether get high BP or no. But they go hospital go check different sick, they discover
because na normal routine, right? When you go hospital,
because you no get sign, especially for the early stage, you no really get sign. Now, signs they come to play. Now when it'll be kind of very like almost the second stage where they start get blurry vision, ringing of the ear, you hear the face, all that kind of stuff, lightheadedness, all that kind of thing.
And that time anything fit happen because na dangerous period that too.
Yeah. And papa the way the people they get stroke, some strokes them they be caused by high blood pressure, of course. Because it is stroke. If stroke happen, if blood clot for brain, or if it burst for brain, it will cause stroke now, because stroke now when your brain be deficient with food or oxygen, therefore blood support go to your brain, but it usually burst due to high blood pressure or blood on clot for this. Yeah, it will cause stroke. If it happen for your heart, it will cause, I think, cardiac arrest or something like that. So people really need to be very careful with high blood pressure. It causes a lot of deadly illnesses.
Stroke, cardiac arrest. heart failure,
Neck hurt, erectile dysfunction,
erectile
ble-
dysfunction, yeah.
uh,
Blindness,
blind-
because by the time you start,
blindness,
your
of
vision
course,
start being
blindness.
cloudy. Yeah, your cloudy vision.
And we and people they get high blood pressure even for lungs, so people they get, I know say plenty people they get them for eye. So you
Mm-hmm.
don't get the high blood pressure people plenty people they get them for kidney.
Mm-hmm.
Yes.
Yeah, yeah,
Yeah.
it
If
affect your kidney too.
if your blood pressure over high for your eye, you know see very well.
Mm-hmm.
Yes. You know see very like I think glaucoma and I think high blood pressure for a big cause of high blood pressure for the eye.
Yeah,
Think
yeah,
so
yeah.
if I'm not
Like
mistaken.
glaucoma, yeah,
Yeah,
that's true.
glaucoma because get high blood pressure too for long. So now a very measure illness way. We feel really work on it. We
Mm-hmm.
feel really help ourselves as we're young, you know. Even when you don't old, yeah, exercise, all that kind of thing. We feel we hand for day, we feel help her.
Mm-hmm.
Yes. We feel
I
really,
mean,
yeah.
like
Really,
right
yeah.
now, a lot of things that cause stress, especially for my people back home, Northwest and Southwest, where crisis they go on and a lot of fear. Fear. If you not know what to fear, you not know how detrimental fear is for your health.
Very
Oh
true.
Lord, have mercy. Fear and stress. Fear and stress. My people no go live long. Oh. Honestly, my people back home, Northwest, Bamenda in particular, I dey talk so I be so emotional when I dey talk about Bamenda. I be so emotional and like I love Bamenda. Bamenda play where I grow or wait till I decide it happen today. When I think of it, or when I see the thing the way they happen, all I dey cry. My people no go live long. Because wait till they incur am back home. The youths where they grow back home, that one go be a story for another day. That picking the way they grow, till the way they see am now, how we go affect them? We'll talk about that one, we talk on the mental, how it will affect them mentally, because even physically. So that is a lot. Only that one way it happen back home. You know, the way people that have blood pressure, they feel all rise, but when they don't even know,
Oh, it's a joke.
but when they
It's
don't
a
know.
joke. It's a joke.
Now many people
This
get high
crisis
blood pressure now, so
you don't cause
northwest,
people a lot
southwest.
of
That they don't
very
even know of.
dangerous.
People that are shops them born, market born for Bamenda. People that are shops them born, their livelihood is born, coupled with the hardship they go on for Bamenda. And they imagine the high blood pressure. And
Worry. Worry, I
they
don't lie.
imagine so guys in all, please, would just like for like one share more light into this because they need to call a silent killer from nothing. They didn't call am so for nothing. So please no say if you get high blood pressure, you no go get any symptom. So go hospital. Even if not, they pay for check this thing plus.
They pay if you go for private clinics, I think pharmacy they get you pay 200 you measure your blood pressure.
Ah, now which kind
Yeah,
of
200 fees.
speaking of free, those are the kind of things that are supposed to be free. I mean, all that thing is
No,
supposed to be
if
free.
you're not supposed to be free. If
If not
it
be
be
seen at the
free,
government, what do you mean? If not be seen at the
yeah,
government, the high
you're
government
not
will get
supposed to
them.
ever be free. You're not supposed if you be free, people no value am. If I may go take am money, you pay. So that you know say if you high, you know say na serious thing. If you be free, no man no value am. If I may go pay, me they pay 200 no be
But
na something. Me they pay the
it wasn't
200
at
measure.
200 with the way things they not expensive
I
back
don't
home.
know. In those days, it used to be 200. I don't know about now. 200 fans, you get your blood pressure check. In fact, why getting your blood pressure check even? Regulate your lifestyle.
Regulate your
To be
lifestyle. Yeah,
more
but
active. To be very
of course,
active.
like at least once in a year, intentionally go for the checkup.
Yeah, yeah.
Yeah. So we'll talk more on that lifestyle. We'll talk more on that
Yeah.
lifestyle. Yeah, because
Okay.
it's very important at the end of the day.
Yeah. Normally, it shows say if you dey do sport, if you dey eat well, like you take all the like nutrients, them, your chop give you vitamin D3, magnesium, all those stuff, them.
Yeah, for
You
that one
understand?
to pay, I know say we no overget problem when it comes to nutrient because
No,
we not really
no,
over yes, we not really overget
no.
problem because most of no
You know
honest.
we talk so. Man shock you. You know we talk so because the common man will pay the chop how many times? And you chop balance diet.
Oh
No,
yeah,
we
yeah,
won't
yeah, yeah.
talk.
Even if that one regulate, even if that one.
No every day. People don't even fit up to 3 square meal. Then if you take balance that, how many people if you buy apple for market or mango?
No, the
How many
quarter go
people?
farm no cross. No,
How many people they give farm? And by the outside, people don't even go farm again.
not true.
Yeah. And by the outside, people only go farm. How many people they
And
think
I
say when
just
you chop, you go
and
take
chop not expensive too. Very
expensive.
honestly not expensive.
People fit barely afford am. People fit barely afford am. In fact, number one medicine for this thing na food. If you eat right, take vegetables. If you eat right, you no need for go hospital. Yeah,
And
chop na your
regulate how you eat. Regulate how you eat, guys. Because
alcohol, beer for pay beer. Hey, na you go give for high blood to take kill am.
I see for news the other day say they say how many billion you see that
Eh,
news.
okay, how many billion liters?
How many billion
But then
liters
make 10
of
billion
beer be
francs.
consumed?
But then remember that 80 billion francs for Cameroonian every year. 80 billion francs.
Yeah, yeah,
Just
we
imagine. Just imagine. Just imagine.
yeah, we be consumed. So
You see, small youth, small youth get very
yeah,
big belly. Very big belly. Just imagine. Very when a beer, alcohol all time back to
yeah,
back and alcohol,
we
smoke up,
consume
smoke
alcohol.
down.
Yeah, and let's normalize exercising. Let's normalize exercising. Go do exercise. And I want to always be about me across. I mean, like right from PE. Like I don't always just love them. So if we just like love it, if you like make it like a habit, say no, I find pleasure doing this thing. I find pleasure doing it. I find pleasure taking a walk. I find pleasure getting up. Just, it's a pleasurable activity, to exercise, even if for 15 minutes a day. It's so important. It's very important.
Like, people dey pay dey just foolish. You wan go store for downward, store for 15 minute walk, you enter bike because na people dey look you say this that. What? Just walk at least. Na remedy that for your just
Now,
take a
remedy,
walk.
oh,
Take your
yes,
na
walking
remedy for your situation.
actually na
You go
exercise. If you know
walk.
me now, so when I did work, right? If I did for work, even if I get, yeah, it get, especially for us for here now. So most of us we dey do most people here they dey do warehouse jobs. The way you dey waka. You understand? Also, this one are like a tip. If you know, so you dey work for warehouse where you dey waka up and down, up and down, up and down, up and down, right? Don't see am like you dey work, like you dey suffer. Never see am like you dey do, like you dey do it, you do am for yourself. Be intentional about it. Okay, right now I am doing this for myself. It's my exercise. I am exercising. You understand? And when you do like that, when you condition your mind that way, you dey enjoy the work the more. The work wey you dey see and dey say na suffer, you go like now tend to enjoy it, and it will become easier. You understand? It will become easier because,
So
yeah, of course, I am doing my work. I am, you know. So do I like you do it for yourself? Yeah, you understand? So that one I just like a tip
so
of advice I get for some of us who really do that hard job here to survive. And also, when it comes to the stress aspect, you cannot saw sawdust. You cannot saw sawdust. If any situation the way you say and say, yeah, if I can take care of this situation, good and fine, you take care of it. But if it's inevitable, if you not be control, if you cannot control it, please do not. You cannot saw sawdust. You know fit. There are things we cannot control. Cross. There are a lot of things
just
we
let it
have
go.
control over life that we don't have control over. So if you know you don't have control over something, don't beat yourself, or don't beat yourself up because
What about just living for the moment? You just need to live for the. You don't need to live for the future. You live for the past. Living in the future cause more stress. Living in the past cause more stress. Just live for the moment. Don't need about tomorrow. Yam done, yam not done. Until you don't pass. Live for the moment. Save a lot of
there are
stress.
some things, cross, honestly, it's not as easy as the way they talk. So
Yeah. Yeah. See, like for instance, from the past, just pick out some few things as a lesson. so they know how to modify the future. Not live every day you're thinking of the past. No, live for
Yeah.
the moment.
Yeah.
No
So
ever touch the past, the future.
yeah. So
Ever.
we are being real, we are being realistic right now. Would it be so realistic? We are keeping it real. And in as much as we get a lot to talk about and we really want to shed more light into this, we have to wrap it up. So to wrap up, Cross, what do you have to say?
Okay, for wrap up or start from home, back home, for all my mothers there, na mommy whole house. When mommy I beg you to cook, turn no more sweet that
Hmm.
way you dey think. Yeah, just moderate, moderate
And
everything. Put
and ma Adam,
salt level.
you see
And
all the
yes,
seasonings, the way we dey put am for chop, all the seasonings contain salt. Apart from
yeah,
tomatoes and onions and those seasonings they would buy and those spices them, most of them contain salt. So when you dey add seasoning, they add the salt. So be rest assured. No say this so na additional you add your skin. Salt
hmm.
and Maggi. Maggi also contains salt.
Same no, same.
Yeah,
I tell you,
Maggi
anything you
contains
make a drink
salt.
plenty water,
Mm-hmm.
anything you make a drink plenty water, na problem.
Mm-hmm.
Na
No
problem.
problem.
Anything you make a excess water, na problem.
Yes.
Na problem. So
So
for my repair them. For my repair them, be they reduce. I know say stress day or stress for workplace, stress for house, but man of it key itself.
mm-hmm.
Eh? People they go for bar for go drink alcohol, smoke cigar because they don't forget about the stress, but they inside key yourself.
But when they say
So
add
you really
their skin,
inside at
they
it. So
say
you need really need more. They really
yeah.
need for moderate
And
moderate their
if you
intake.
want look am most that cigar and that alcohol, you know fit really add plus kidney, liver issues the way it come for future.
Course,
Wey dey come for
of
future.
course,
Their lifestyle
of
changing.
course.
Lifestyle is very important. Look at all these actors wey they don't just die for Nigeria. All these actors wey they don't just die of recent. Let's
Come
learn
on.
from all of these things. Look at the way they died. Look at the disease, what they go through. Some of this life we live are here right now. This alcohol we drink, you know what affect me now. Right now, we like, yeah, it's all good and it's all fun and good. But think of the future because when you want happen, and let me say something clear. There is something I don't forget who said this, but your body keeps a score. This I want make everybody understand say whatever you are doing, your body dey keep score, it keep tabs on everything wey you dey do, you dey consume am or anything wey you dey do am. For example, if you dey work hard work wey you dey deal with heavy lifting or if you dey overbend, right? You dey do work wey dey deal with heavy lifting, your body e dey keep score of everything wey every stress, every trauma wey dey put am for your skin, e dey keep score. Dat alcohol wey you dey drink am, if you dey drink am, of course when you drink alcohol, your body you fit give your body some time to detox, right? But if you be say you dey drink am regularly, your body dey keep score of everything. When dat time don reach, some time go reach, you wan reach some age, the problem dey go wan start am, e no go stop. Kidney, liver, diabetes, all those e go one kind e no go stop. You wan hear you go say oh make dem amputate your dis thing, make dem do dis one, make dem do dis one, whereas it's already too late. So remember that your body keeps tabs of everything that you're doing. Your body dey keep
True.
score. Yes. So we are wrapping this up and
Yeah.
thanks for watching. We just want
That
make people understand say this so high blood pressure you no get symptoms and let's normalize checking, let's normalize going to the hospital for checkup. It's very important to know so that we'll be able to regulate. Those of us where they abroad, if you fit buy it be easier for it be accessible for buy them other than online, go for pharmacy. If you always buy the this in the major of a house by yourself, so when you fit always keep tabs on your blood pressure, which is really nice. Then for back home, I don't know if they sell it for pharmacy, but you should always ask. I don't know if they sell it in the pharmacy. If they do, and if you fit get them, buy them, buy them. For some of us abroad, we fit easily buy them. Make we try for buy and send them for people back home. So that they fit use them, especially our mothers and fathers, so that they fit use them. They also keep tabs by themselves. They keep tabs of their blood pressure, not necessarily going to the hospital all the time. So, Cross, anything to add? You have
Yeah,
what?
our life will talk about breastfeeding mothers, people wey dey any level breastfeed their pikin and girls and they fear say that body go fall. But if you always give your
For
son or
real.
your daughter a long life or a better future, you need to breastfeed your pikin because it be very, very important for the pikin genetic makeup. Then people wey dey say no alcohol, this or that, say okay, me I no drink alcohol since alcohol dey cause high blood pressure or drink na sweet. Different no dey o. In fact, take all things in moderation. No
Yeah.
overdrink sweet, no
You can
overdrink
be an
alcohol.
occasional drinker. Occasional drinker. That is me. I am an
But
occasional drinker. Yes.
no
So if
moderation.
I drink today, by the time I want to take my next this thing, my body could not detox today. Then they say alcohol. I never see alcohol because I drink occasionally. Sometimes you go 2 months, so I never see alcohol. So you can begin by being an occasional drinker, not a regular customer for alcohol. So
One
yeah.
last thing I say, I encourage our people that make it fast. Like if you take a month for chop one time one day, no more chop all the time.
It's
Yeah,
your
like seriously, chop one time, take a 17 hours fast. Very, very important. You detoxify your system to 100%. You